Hello, dear colleagues. My name is Peter Borchmann from the University Hospital of Cologne in Cologne, Germany. I'm chairman of the German Hodgkin study group, and I'm glad to share some data with you from this year's AS from our abstract entitled Comprehensive Analysis of Treatment-Related Morbidity and Progression-Free Survival in the German Hodgkin study group phase III HD21 trial, which I'm happy to present on behalf of all my co-authors. We did this study to challenge our standard of care, which is individualized PET2-guided escalated BrECADD, a very intensive regimen. However, it allows to treat more than half of the patients only with 4 cycles of chemotherapy with excellent outcomes. Nonetheless, it has severe toxicities, induces gonadal toxicity, infertility, and some other problems coming along with this regimen, and therefore we modified this with the help of Brentuximab vedotin to the so-called BrECADD regimen. This is just a 3-day regimen repeated every 21 days, an outpatient regimen, which we have seen can be easily done as outpatients in adult patients aged 18 to 60, so the main cohort of Hodgkin lymphoma patients. We did this randomized phase III trial, compared these regimens in a face-to-face manner, both PET-guided, and we had analyzed the co-primary endpoint already, which was reduction of toxicities. This one has been very successful, and also non-inferiority, which we could show at an interim analysis with 40-month follow-up last year. So we know it is in non-inferior, and we also know it's much better tolerated. However, we wanted to go into detail on any correlations between tolerability on the one hand and efficacy on the other hand. And what we have seen is that with the better tolerated BrECADD regimen, it's possible to maintain the dose for more patients over time, meaning if you start with 100% dose in the first cycle, then there will be reduction in escalated BrECADD with a 4th cycle or 6th cycle, which are really relevant, and 20 to 25 patients, so 20% of patients, 20 after 4 cycles, 25% after 6 cycles, treated with BrECADD will still receive full dose as compared to escalated BrECADD. So this is highly relevant in terms of tolerability. It's better tolerated, therefore it can be higher dose, which also then explains the progression-free survival results we have observed. Our assumption in this trial was the outcome should be very similar, identical actually, so that's our assumption. However, we observe clearly better outcomes with BrECADD, which is 97% PFS at 3 years for PET-negative patients, so extremely high. We have never observed something like this before. And also for the PET-positive patients, which used to be a high-risk cohort, and this is not true any longer. The PFS at 3 years is 39.5%. Overall, this results in the best PFS we have ever observed in any of our trials, which obviously is good news for our patients, even especially with regard to the good tolerability, which includes also gonadal toxicity, which was presented in another abstract at this age, and in which we could show that gonadal toxicity is not different from just ABVD. Efficacy, however, is very much different. So this is good news for our patients, and I'm glad to share this information with you.